disorder includes issues with sleep quality, timing, and quantity, resulting in a daily distress and functional impairment.
Sleep-wake disorders are frequently associated with physical or mental health conditions such as depression, anxiety, or cognitive difficulties.
Sleep disorder is a fairly common condition. We have all heard of sleep disorders like sleep apnea, insomnia, and narcolepsy. Some sleep disorders, on the other hand, are much less common, and information on rare sleep disorders can be difficult to come by. There are 5 major types of sleep disorders.
First is restless legs syndrome, in short RLS. It is a syndrome in which an uncomfortable sensation causes your legs to tremble or shake. It usually occurs while you are sleeping at night, making it difficult to fall or stay asleep. RLS may affect anyone at any age. However, it is more frequent in adults and get worse as they get older.
Second is insomnia. It is a condition which causes you to have trouble falling or staying asleep. Insomnia is classified into 2 parts, acute and chronic. Acute insomnia is a kind of insomnia that occurs for a brief period of time and is caused by jet lag from overseas travel or a traumatic incident. Chronic insomnia is a type of insomnia that lasts longer than a month.
Third is REM sleep behavior disorder, in short RBD. It is a disorder in which a person acts out his or her dreams, whether are simple, dramatic, or violent. Persons with RBD do not experience the paralysis that occurs during the REM period of sleep.
Fourth is sleep apnea. It is affected when sleeping, leading you to wake up unexpectedly. You may have pauses in your breathing or release shallow breaths if you have this disease.
And lastly is narcolepsy. It is a term used to describe uncontrollable daytime sleepiness or drowsiness. People with these disorders are prone to having sporadic fits of sleep during the day, even while handling machinery or working.
Bad effects of this disorder is that it can lead to obesity, stroke, diabetes, increased risk of hypertension, heart attack, depression, effect on mood and energy, possible car accidents, impaired job performance, strained relationships, memory problems, and lastly, weight gain.
The things we need to avoid that cause sleep disorders are caffeine, nicotine, and alcohol late in the day. Caffeine and nicotine are stimulants and can keep you from falling asleep. And also, alcohol can cause waking in the night and interferes with sleep quality. And make sure to avoid eating a heavy meal late in the day.
Make your sleeping place comfortable. Be sure that it is dark, quiet, and not too warm or too cold. If the light is a problem, try to use a sleeping mask. If a noise is a problem, try to use earplugs, a fan, or a white noise machine to cover up the sounds. If you can't fall asleep and don't feel drowsy, get up and read or do something that is not overly stimulating until you feel sleepy. And lastly, try not to take naps during the day because naps may make you less sleepy at night.
For the conclusion, sleep-wake disorders often occur along with medical conditions or other mental health conditions such as depression, anxiety, or cognitive disorders, especially now in times of pandemic, we need to have sufficient knowledge about this disorder to maintain our healthy lifestyle.